already on the line Dr. João Breda from WHO, Director of Patient Quality in the Athens office for WHO Europe. João, can you signal that you are listening to me?
I can hear you very well.
Okay. We are fine here in Cardiff. Sorry that you cannot join us as planned initially for 2 sessions, but at least we're going to have the chance to hear from you. So I think the floor is all yours now.
Thank you. Thank you very much. And the best from Porto. I'm here at the WHO conference on AI and health, which also relates with a lot of what we're doing today. I'm going to share with you. I need to request to share my slides. I have a couple of slides to illustrate a bit what I'm planning to say. The discussion today is really on quality of care and patient safety, and therefore I would give you a tour of what we are doing in our office, the WHO Athens Quality of Care and Patient Safety Office, which is based in Greece but belongs to WHO Europe, and also, of course, linked to the aspects of data, digital health, and AI, which is obviously an area where we've been working and really accelerating in the last time. So let me see if I can now share my slides. Here you go. I think it should be okay. Can you see it? I believe should be possible to see it. You can? Okay.
Yes, we can see.
Okay, thank you. So basically, the WHO European region is composed of 53 countries. And one of the challenges we are faced with is really the issue of equity and inequalities. We have huge disparities in many health indicators. And if we look at this one in the slide, just basically life expectancy, you see the differences between East and West and North and South, and really differences between men and women. And really a lot of this has to do, of course, with many factors, some of them which are related with behavior, but also in the way our health systems perform. And they also link with quality and patient safety. We all acknowledge, and we are challenged also with the progress of an increase in the prevalence of many chronic non-communicable diseases. And more worrying is really that you see more and more these comorbidities, a combination of several problems altogether, particularly as the population ages in many countries of our region, especially those which are part of the European Union, or those who are more in the group of the most affluent countries. I remind you that we include many countries which are on the eastern part of Europe, including Central Asia, but also some neighboring countries of the EU, like North Macedonia, Montenegro, Balkans, Albania, and therefore there's a huge variety here. Certainly, one of the elements we've been looking into is really the chronic non-communicable diseases and the differences in terms of the quality of the services provided, and looking into how digital approaches can really improve. And this has been shown, improve the situation. This has been shown. It's nothing new to anyone, but how we can really make sure that we can use these new opportunities to really help countries leapfrogging those who are lagging behind, but also within countries, how we can really use these opportunities in an ethical way, having really having always on top of our mind the issues of equity, trying to move forward in implementing these really great new opportunities. We have basic elements where quality of care and patient safety and challenges, and I bring here an illustration on hypertension, because this week we're launching a very important global report on hypertension, and nothing new, but guess what? The main, let's say, challenge we face with hypertension is really a matter of quality of care and patient safety, because we are not able First of all, to identify those living with this relatively easy condition to take under control in the good, high-performing health system. And many of those that we already know that actually have hypertension, they don't have it under control. So a very basic, let's say, health condition that can be easily identified and treated when necessary. We do have enormous challenges there, and we really need to use digital opportunities to better tackle these aspects. Another one aspect I would like to share with you, and we deal with a lot, is really on safety, and patient safety is critical. We have globally one out of 10 patients is armed when going to receive some type of health care. And this is a global data, but the European region, we have huge variations, but we're not that far from this. And we do have countries where the situation is really tremendously challenging. And therefore, it's really an area where we are starting to collect more reliable data, which is, let's say, shareable and it's comparable in this area. But just to say that there's also an area where there's a long way to go in the WHO European region to address that. And because we are worried with these challenges, but we see the opportunities to use digital and AI as tools really to improve and to tackle the inequities aspects in this area. One of our, let's say, core business elements is really to work around data. And we are very proud that last year we launched for the first time a report that collects information and data about the situation in all countries that belong to the WHO European region, the 53 countries. We call it, it's a report produced for the first time. It has also a nice compilation of a country fact sheets. It's called Taking the Pulse of Quality of Care and Patient Safety in the WHO European region. Is downloadable and available online. And one of the challenges we were faced with, we looked at more than 100 indicators. And for most countries, we can only collect data for a very small minority of these indicators. And in many cases, it's really hardly comparable. Therefore, it's a major challenge that when sometimes we are discussing highly sophisticated and more high-tech cutting-edge approaches, there are many instances of our lives and in many cases, people living in certain places or in certain circumstances where data is not at all available at the minimum. So it was a call for countries to do more. Many countries needed to establish action plans on quality of care and patient safety, and they don't have it. There was also an identified need for improvement in the area of patient safety, as already shared before. And really, we also try to incentivize or to motivate countries to do more based on their own country profiles. So significant aspects in terms of patient safety, which place the WHO European region not so much ahead of other regions. Normally, we sort of have a slightly better performance, but not in this case. There's many things where we're lagging behind, and you have some examples in this slide. So only about, let's say, 1/3 of the countries sort of have either national action plans on quality and patient safety or individual ones. So really a lot of work to be done here. Having plans doesn't mean that we do things on the ground, but having a plan is something which is very important. And those plans, in many cases, they don't include yet the provisions around AI and data. And we also notice that. One of the things I would like to highlight is that we really always look for patient engagement, representativeness, involvement, co-creation approaches with patients. And it's really, in a way, if I may say, a bit appalling that in our region, in most cases, only one out of 10 countries include patients in the processes of health policy and specifically on quality of care and patient safety. So the report also includes a series of indicators that if you would be interested, you can have a look. And we ended up with a selection of those where we can find better opportunities for comparison across Europe, but really huge difficulties in finding data in many countries and making sure that countries report both to OECD, to WHO. We have joint data collection opportunities as well, but also more there needs to be done. Clearly an issue around mental health, particularly for children and adolescents. In our office, our program in Athens, we have a specifically dedicated initiative on quality of mental health services for children and adolescents. And one of our most, let's say, iconic products is that we developed last year standards for mental health services, for quality mental health services for children and adolescents. And one of the things we also realize is of course, that the use of digital tools and AI and all those opportunities also need to be discussed in that context. And here, just an illustration with this slide, where you can see that really in many cases, there is still a lot of work to be done in the area of quality of mental health services. So this is something we do in quality of care and patient safety. The WHO European region is the only one to have a specifically dedicated from the 6 regions globally, specifically dedicated office and team working on this area, which is based in Greece. And this is only possible with the support of the Greek government. This is why I always like to bring these couple of photos that illustrate the moment where we signed the agreement to start working on this. Our office covers basically 4 areas: technical support to countries, where we work directly with 24 countries, innovation and knowledge, policy analysis, and then bringing together the networks. On the innovation dimension, we're working with many countries. I give the example of Greece and Romania, for example, where we're working around indicators on quality of care, but looking into development of platforms that are interconnected, that for the first time we're collecting data from different sources that were not working and talking together before, and really trying to move forward in this area of also using the assistance of AI to make sure that we can make sense of the quality data, which was sparse, not collected, not put together. And for the first time, we are doing this in these 2 countries. We also are very keen about engaging young people, and everything we do, particularly for them, we always engage them from the initial stages in the process of co-creation. And we did that with all our mental health, quality of mental health products. And we're expanding that also to the other areas of quality of care, same with patient safety. So we are very grateful to the support that we have from the government of Greece. Here is a picture with the Prime Minister and with the Minister of Health, which are great supporters of our initiatives. By helping Greece and receiving support from Greece, we are working with 53 countries in our region, and very intensively with more than 20 of those. These are just some illustrations of some of the, let's say, products that we have recently issued. They're all available online, and I would really suggest that if you have an interest, to reach out and please have a look. Some more of a European nature, and others more of a specific country-specific nature, like the ones you can see in the slides for Greece or also for Romania. So here again, another example. So thank you very much. My last slide, it's an illustration, photo of the day when we received the award of the best WHO team last year for 2024. We are very proud of that. So if you have any questions, please feel free. Obviously, one of the areas where we are really invested, we just had a presentation on AI, quality of care and patient safety here in Porto, and WHO will be working much more on this area in the coming couple of years. Thank you very much.
Before you go, I have a quick question for you. And I look at everybody's eyes because we are just 5 minutes lunch. but I hope you answer quickly. It says, what would you think is the relation, João, of health data and secondary usage of health data could affect your work right now at WHO Athens office?
Tremendously, because our focus is on improving outcomes and outcomes that matter to patients and their families. And outcomes outcomes are basically measurement, and the use of these data is more and more important. This has not always been the case, and therefore, this focus for us is absolutely critical. The use of data at all levels, all type of data. Observing everything that's related with equity, with ethics, and all of that. We're discussing that here in Porto, but issues like really making sure that we have larger data set, that we have more information on outcomes, that we have more information on impact. This is absolutely critical. So the use of this data for us is absolutely central. And I have to say that some of the biggest projects we are working now, both in Greece, but if you want also in Romania, these are projects which are really based and depending on our ability to make sense of the data that we can bring all together from different sources in an ethical and equity-driven way.
Everybody is looking for better healthcare solutions. What if AI could be the answer? AI in healthcare isn't just a buzzword, it's revolutionizing patient care. With AI, we can achieve more accurate diagnoses and personalized treatments tailored specifically to each patient. AI systems analyze vast amounts of medical data at lightning speed, identifying patterns that might be missed by human eyes. This means early detection of diseases, fewer errors, and more effective treatments. But the magic doesn't stop there. AI helps streamline administrative tasks, giving healthcare professionals more time to focus on what they do best, caring for patients. The result? Enhanced patient outcomes and improved quality of life. So whether it's predicting patient needs or making real-time decisions, AI is transforming healthcare, one patient at a time. Embrace the future with AI-driven healthcare solutions. Because better health outcomes start with better technology. Ready to take the leap? AI in healthcare, better diagnoses and treatments, making healthcare smarter, one innovation at a time.
Venture into the frontiers of healthcare data innovation with the Health Data Forum. Welcome to the Health Data Forum's YouTube channel, your gateway to thought-provoking conversations, cutting-edge insights, and groundbreaking advancements in healthcare data. Join us as we explore the transformative power of data to revolutionize healthcare delivery, patient care, and societal well-being. Embark on a journey of discovery. Delve into healthcare data through our informative videos, featuring leading experts, thought leaders, and innovators. Discover how our global movement, Data First, AI Later, is building a strong foundation for ethical and impactful healthcare solutions. Experience the collaborative spirit. Be a part of our vibrant community of health data enthusiasts, where ideas converge, partnerships flourish, and innovation takes center stage. Participate in discussions, share your perspectives, and join us in shaping the future of data-driven healthcare. Stay informed about the latest developments in healthcare data through our comprehensive video library. Catch up on insightful interviews, thought-provoking presentations, and engaging discussions about the role of data as the backbone of healthcare transformation. Join us in shaping the future of healthcare. Let's harness the power of data to transform healthcare for the better. Subscribe to our channel today and become part of the Health Data Forum's mission and our Data First, AI Later initiative to make healthcare data work for everyone.